Here is that we are struggling with to do from our side, because I think to write a Indo-American collaboration project is not easy, more tougher than your own thesis what you have done, and I think you need so much of revision. And we are working with Sudha Iyengar from last 4 years, and I think finally we submitted in last year in November, and I think so one is, as John says, we have to be prepared now, because even why wait till the last week, because it's not easy. There are so many formalities, registrations to be done. You have to get acknowledgement in everything online, and I think only thing I found out is it's a fair review, and I think even in America, I think they have a problem depending on what type of project you write. If you write a genetics project, it goes to the cancer genetics and general genetics, and that's where the competition is too high. But if you write something specific, ophthalmology, like how, it's again a genetic project Ronnie has got, and I think he's got an excellent partnership. So I am discussing with Sandeep for the last 2 years. We are yet to begin. Why not we have DRCR India? And I think even DRCR.net in US started as small, and it's totally an NEI NIH project. And I think a lot of important people are involved in writing the project, and then they have got the going up to T, and the various protocols have been come out. I think we have to start somewhere in India, where I am also spoke to Neil Bressler, who was in the helm earlier, and everybody is ready to help. But I think from our side, we have to become strong. That is from Indian side, and I think DRCR has to start something in India in whatever name you call it. And here, I think at least we are proving now we are not working for any individual name. We wanted to collectively work as India, and I think India has the maximum number of diabetics. I see the other place is China, but I don't know whether they are organized in screening, diagnosing and treatment. I was there in the AVRS in Shanghai, and they claim Shanghai has totally AI for DR screening, but I don't know. I don't see publications, and I think the AI is working in India, and I'm happy we are working on offline AI, both online AI, but I think long way to go. And I think India has the great potential, which other countries don't have, is the numbers. And then we know experts here to collect data. I think more important is robust data, and I think everybody is talking about big data, and if you have a big data, you're going to be a multi-billionaire, not even a millionaire. So I think that means India should become multi-billionaire, and I think with the data, and I think using AI, we have lots to do for diabetic retinopathy, then glaucoma, and also the neurological diseases, where I'm working with thanks to Dr. John Prakash for introducing to the Chinese eye genetic consortium. I went there twice, and Professor from Chongqing, I forget right now the name, his friend, our friend, he's actually asked for a project for the Indo-China collaboration on predicting Alzheimer's and dementia in using the AI in optic nerve. So we are in the process, and I think it's again a new challenge. And I think, is he working with you? I don't remember. He said he's working with somebody in India. I forgot his name right now. Anyway, I have it. So I think we also have Paul Bird here. We have Paul. Yes. So we are working with Sarah. We don't have any collaboration, but we are working with Sarah is the Center for Eye Research Australia in Melbourne, and his colleague or his student who's a PhD, Shrujna, has made a keratoconus international consortium, and I think myself and Aditya Jyot is a part of it. I'm not a cornea surgeon. The idea is to bring people together, and every time I learned this from John, saying that why we are all individually working, why are you doing your own individual cooking, why not we have one place to cook, so that India is represented and not Maharashtra, Bombay, Delhi, like that. So anyhow, we have to solve that issue, and it's our own homework, and I'm happy John is also from our own home, and he's a great guiding spirit. And I think, Paul, we have one good news for you. The Australian embassy in India has, yesterday we had a meeting with the president of RANSCO, that's Professor Heather Mack, who's the president of Royal Australian and New Zealand College of Ophthalmology. The RAMSCO is going to sponsor eminent ophthalmologists from India to go and give teaching lectures in Australia. So I think it's a good move, and I am happy I stimulated Nitin Verma to talk to the Indian Embassy, and I am happy we are also working with Dr. Bhavnas in Delhi. She should work with the US Consul General and the US Consulate. It's not only asking money, and I think the idea is the exchange program, and there are lots to learn and lots to teach, and I'm happy. Yesterday, our guest speaker from Singapore said, I come to India often because it's not only to teach, I learn. So I think India also has a lot of things to offer. The only thing is we have to, it's like playing tennis in your hometown and or in the cricket in there and playing in another country that makes a difference, time difference, the climate. So here, when we are talking about Indo-American and DBT collaboration, I think we have to know the rules of the game. And no point in grumbling. Our team was grumbling, oh, they are asking this, they are asking that. We are not able to get that, I forgot the name of the numbers, where to register. So I think we are at least in process. I know Ronnie has gone through it, and every time I have troubled Ronnie also, how did you do it and can you teach us? And he's always ready to help. And I think one more, second project has already gone with the Sudha Iyengar, that is Madhavan and Rajiv Raman. So I think earlier, I think All India Institute had, and then when Kalk first time, I think Shankar Netla had, Arvind had, and I think Arvind had a big project on Eels disease about 15 years back. So I think it's all in, and we have lots to offer, and for that we have to work hard. And I think more than working hard, I want to use the word, we work with passion. And I think we have a lot of people working for passion in their own institute, but I think now we have to have work for passion for Indian research. And we have I know Bakalesh Kamar from 80s, and he was a junior most that time, and I think he used to come and question Dr. Badrinath, why are you not doing this? And I'm sure he was there when Karl Kupfer was working with us. And I hope I can ask Bakalesh to tell something, because he's now, Dr. John, I don't know whether Bakalesh gave any comments. He's working in the with
Absolutely.
the yeah.
Please.
No, he's worked with as a research vice president with Cadila, and I'd like him to tell a few words about research in India. And I think you're one of our mentors, and before Ronnie George's time, you used to come to Shankar Netral. No, can you give your comments on research in ophthalmic research in India, and maybe Sandeep also to say something. Yeah, I know he comes, but he has to stimulate us to work together. Yes, sir. Yes, Bakalesh.
Lati, thank you for kind words. I don't deserve them. But my first interaction with NEI was through Karl Kupfer. So for the work we did on the cataractogenesis and medical therapy of cataract, it was presented at Asia Pacific Conference, and somehow it got notice of Dr. Karl Kupfer. He sends the word through Dr. Badrinath, because by that time he noticed it, the conference was over. I was back home in Ahmedabad, and then he sends a message through Dr. Badrinath that he would like to see me. And he gives a specific slot in Chennai. And then he met me, and I'm sure everybody knows him. He has a nicer way of doing it things. He will not tell you upfront what he's going to do. He says, whenever you are in US, just send me a mail. And at that point in time, it was a year later, not emails. This was 85. And try to see me in NEI. I said, I was just assistant professor, and he's a director. I said, how is going to help me? But anyway, since I said, I sent him a mail. And response I get is, what is the date convenient to you? I said, this is my plan, and I can do this. So he said, okay, on a particular day, you come and give a talk at NEI on what you have done on cataractogenesis. So that was my first interaction with NEI. And in the same breath, I visited various universities and did things. Coming back to Indian part, see the DRCR network. In India, what we have to learn is learn to work together. Learn to forget our personal or institutional priorities, and that's not happening. So if a DRCR network through DBT, if they can do it, say DRCR part of India, if it can be funded by DBT, then you don't have a funding requirement coming from US and you don't have an obligation. You share some of the protocols where the investigators in India are willing to participate. DBT funds Indian part of it, which is their program, because that's, I think, the understanding between the two organizations. And then we can have some program running in India, start it, and then expand it. And I'm sure PGI, All India Institute of Medical RP Center, LVP, Sankar Nitralaya, Arvind, at least they can join if there's a common protocol coming from a DRCR network and there's a common meeting organized. Nati, this is for you. You can do this. You can call a meeting of a vitreoretinal surgeons interested in diabetic retinopathy in PGI, RP Center, LVP, Sankar Nitralaya, Arvind. Talk to Grover. Have some common protocol agreed. Apply for a DBT common program grant, where this part is funded by DBT, the other part is funded by NEI. In any case, it is funded. So they might have to share some software or access to the software through the computer network. And then you start going. The other point, I mean, since we are talking about diabetic retinopathy, and I saw one of them is persistent diabetic macular edema. As a part of faculty, we did some work some time back. Small study. Those who have persistent diabetic macular edema, in spite of injections and lasers, how do you do that? So there is a product in India which is available, which is a multi-component product, which includes TC inhibitor, statins, aspirin, beta blocker, and hydrochloride, diuretic. With that product, people start responding. It takes a little longer time, but they don't have to lose anything.
We should start.
And they regain the vision, the macular edema decreases. So a project like this can be taken up for this network, because this product may not be available in US, it's available in India. So this can be a starting point. Thank you.
All right, thank you so much. I think your feedback is just so good that that's a perfect segue for the next session, which is fortunately I'm co-chairing it, and Dr. Natarajan as well. So I would request that everyone stays where they are. Dr. Paul Baird, I would like to, in about a minute or two, he could come up to the stage to co-chair with me. But my co-chair and moderator of this session, Dr. Bhavna Chawla, would like to say something and officially close the session. But please stay in your seat, and we'll begin the next session.
So thank you everyone for your participation and your active feedback and comments. They're really valuable in helping us, grow and achieve our objectives. So I hope really that you enjoyed this session and you got some good takeaway messages from this. And you all will start working on the R01 grant and the idea of collaborating and working together. Thank you. So can we have one photograph of the panelists and the speakers before we close this session?
You just want this session?
You have been to that. Yes.